Let's say that you and your physician have come to the conclusion that hysterectomy is the best approach to deal with the particular problem that you're working with. When that's the case, one of the common questions people have is what's the best way to do this? And basically there are several different ways you can use to approach doing hysterectomy. It can be done an abdominal hysterectomy through a big incision in your belly, or it can be done vaginally, or it can be done laparoscopically or robotically in a minimally invasive way. Probably one of the more common approaches these days is to use a laparoscopic approach. And the laparoscopic approach is really a great way to have the surgery done, but to be able to get back to home as quickly as you can. Usually people only end up having to stay in the hospital for a day or so, and many times can go home even the same day. So the laparoscopic approach is a great way to go. In general, for us at Beaver Women's Health, we've been doing laparoscopic surgery for nearly 15 years for hysterectomies. So in our hands, almost 95% of hysterectomies to 98% are done laparoscopically or vaginally, and we very rarely find that we need to use an abdominal approach. It really turns out to be a discussion though between you and your surgeon and the skills that your surgeon has. If you don't have specific medical indications to have hysterectomy done abdominally though, and your surgeon really wants to do it abdominally, it might be time to look to find somebody who has skills to be able to do it laparoscopically. For us at Beaver Women's Health, one of the major focuses for us has been to try to stay at the forefront of the developing technologies that really help us to provide the best care for our patients. One of our goals for the last 15 years has been to try to optimize our surgical approach to make recoveries faster, less painful, less uncomfortable, as cost effective as we can make it, and as much as we can, doing as much as we can to get people back to life as quickly as they can. In an effort to do that, we've really stayed at the front edge of surgical skills and those interventions in order to try to optimize care people receive. Part of that has been developing surgical skills and minimally invasive surgical skills in a way that allows us to achieve that.